Hello, everyone. Rukhsi from Creatifecundity Incorporated is here with episode 10 of the Social Change Creatively for Justice video series. This episode is extremely personal for me because of my current experience with healthcare and elderly breakdowns and illnesses. Due to our current COVID-19 with its variants such as Delta and Omicron and the havoc that they have wreaked over all of us, our healthcare systems are intensely focused on finding treatments and cures for COVID-19 and its variants, but have neglected other ailments, such as elderly illnesses of Alzheimer's disease, dementia, Lewy body dementia, which is similar to the Parkinsonian family of disorders, which have different symptoms, such as more pronounced tremors, overactive hallucinations and dreaming, a shuffling gait, and loss of neurological and muscular control, as was explained to us by the neurologist of my parent who was recently diagnosed with moderate to severe level dementia. However, compounding my parents' diagnosis of dementia is a mental and behavioral health breakdown. My parents' situation further degenerated in the hospital when I, with fellow family members, literally had to go and feed our parent, utensil to mouth, and explain how to eat, to chew, 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 and swallow food. As there was only one nurse supervising the room of two patients, there were times when we had to help our parent out. When my parent was discharged home, as a result, my parent could no longer engage in independent self-care, where now there is a dependence on others to do all the basic life activities, eating, toileting, and even walking for my parent. When we asked for assistance, such as a reduction or cutting down of my parents' home taxes, we were met with a most insulting and callous reply from local government and village officials that we had to move out, despite the fact that my parents had paid them taxes over the past 30 years of their lives. The wealthy class can pay for all the health care and resources they need from out of pocket, and the government can pay through Medicaid insurance for the most impoverished and at or below poverty line individuals like me. But the middle class, those who are in the same situation as my parents, have no recourse, no support, as their insurance does not cover long-term care if they had not purchased or prepared for it and do not have the means to purchase it anymore. They are badly stuck, and nobody is helping to remove them from the bog of despair. Our healthcare system needs a complete overhaul, and we need a change in our perception of our elderly as done and dusted with their lives, when they are capable, have so much life within them to continue shining their characters and talents out into the world and bringing reassurance and ease through their glorious wisdom and experience. We need to question why our media, including our social media, has an unhealthy fixation on youth and start to discharge our elderly as they age and begin to lose the colors and vibrancy of their younger years. That does not mean that their lives are over. On the contrary, we have the ability to begin our lives anew at any age through our developing realizations of our passions and compassion for ourselves and our abilities for a highly engaged and doted life. Our healthcare system needs to be replaced with our community councils that I have discussed in previous videos in this series. And those community councils designating neighborhood health guardians to take care of families in crisis situations where the wealthy companies and government are charged with providing healthcare costs for the financially burdened, strained, and hindered in our communities. Our community councils can also designate special health transport guardians who safely transport our elderly and physically impaired to and from their homes and hospitals and doctors' offices. Currently, my parent has an appointment at the hospital for CT testing. However, the hospital cannot arrange an ambulance or ambulette covered by insurance for taking my parent to the hospital for testing and from that hospital back home. And my parents' doctor places the responsibility on the hospital for transport, whereas the hospital declines all responsibility and places it on the insurance company. When you speak to the insurance company, such as Medicare, they will tell you that no, their responsibility is not to provide ambulance or transport for elderly patients to and from homes and medical facilities, no matter how much they are in need of testing for alleviating their pain and medical conditions, and insurance will place the responsibility back on the doctor and hospitals who keep pointing fingers at one another. This injustice is currently going on and on with our healthcare system, and we as people are caught in between, rendered unable to change these circles and circles in which we find ourselves endlessly. Giving our medical transport to responsible individuals at the community council level will help to address issues responsibly and reassuringly. Our healthcare system needs to change from being run by dollars, profits, and riches too, revolving around cures and restoration of independent self-care to all our community members. Thank you for watching, liking, commenting, sharing, and subscribing to this channel. I leave you with healthcare should not hinder healing and cures for our elders and community members. overhaul healthcare systems and monetary centered modes for elder and community member diagnostics and life